Question 23. Joints of thorax and thoracic apertures. Firstly, you have sternocostal joints. The first rib is united to the sternum or manubrium by synchondrosis, so it means it's a cartilaginous joint. And the remaining true ribs are synovial joints. They have radiate sternocostal ligaments, and the second rib and cartilage have intraarticular sternocostal ligament. Next we have costovertebral joints, where the ribs are attached to the vertebra. There's a fibrous capsule that envelops the joint, and this is called the radiate ligament of rib. And then you have an intraarticular ligament that is connecting the crest of head to the intervertebral disc. Here you can see the crest of the head between the inferior and superior articular facets for vertebral body. So it's attached with intraarticular ligament. Then you have costotransverse joint between the transverse process and the transverse and the rib. This is a synovial joint. You can see the synovial cavities here, both of them. And the tubercles of ribs articulate with the corresponding transverse process, except for the 11th and 12th rib. And these synovial joints are supplemented by costotransverse ligaments. You have lateral costotransverse ligament, superior costotransverse ligament, and intertransverse ligament. You have superior costotransverse ligament. And lastly we have the inferior thoracic aperture. It is almost sealed by diaphragm, and it is traversed by the aorta, the inferior vena cava, and esophagus. The superior thoracic aperture, or superior thoracic inlet, transmits the esophagus, trachea, nerves, and important ducts and vessels.